Hello everyone, my name is Rohan Ravindra Metange. I am a second MBBS student from Dr. Ullas Patil Medical College Hospital, Jalgaon. My today's topic is prescription writing. Definition: prescription is a written order from a registered medical practitioner to the pharmacist to compounding or dispense a specific medication for the patient. Prescription is actually a direct link between the physician, pharmacist, and patient. Prescription is accompanied by the direction for a pharmacist and for a patient. Introduction: prescription may be entered into the electronic medical record system and transmitted electronically to the pharmacy. A prescription may be handwritten or pre-printed prescription form that have been assembled into the pad or printed into the similar form using a compound printed even on a plain paper according to the circumstance. Prescription may be the submitted form of the physician to the pharmacist orally by the telephone. This practice may be increase the risk of a medical error. Now the part of prescription: superscription, inscription, subscription, and transcription. Given format is prescription format. Now the superscription. Superscription is consist of the physician information, patient information, and the prescription symbol. Now the physician information: name, qualification, and the address of a physician and date of the writing of a prescription. The physician details are essential for the identity of the prescriber. The date help in the judging the interval between the issue of the prescription and that of the dispensee. And the patient information: the name, address, age, sex of the patient, and the patient name and the address of the patient are the important to the facilitate the handling. The age of the patient help the pharmacist to the recheck the correctness of the dose and a prescribe. The prescription symbol. The symbol RX stands for the Latin recipe meaning take through. The oblique line after the RX is just a convention that all the doctor follow. Now the inscription. It is called as a body of the prescription and the contained drug information. Name of the drug, the dosage form like a tablet, ointment, injection, etc. The strength of the formulation. When there is a more than one drug or more than one ingredient, their order should be as follows: basis, adjunctant, corrective, emulsing, vehicle, etc. Now, the basis. It is a primary or principal or active drug for a particular clinical condition and should be written first. Example: chloroquine in malaria. Now, the adjuvant. It is a drug based on an enhanced supplement that is the action of the basis drugs and or for another associated symptom, and it follow the base in a serial order. Example: paracetamol in malaria. The corrective. Drug used to overcome any undesirable effect of the base or adjuvant, etc. Dampido, emulsing, and vehicle. Now the subscription. Subscription is a direction to the pharmacist. Subscription it consists of the instructions related to the mode of compounding, amount to be compounded, the form of the final medicament, and the division into the doses if required. For a pre-compounded prescription, it contains the number of doses to be dispensed. It also the mention refilling instruction, that is whether the repeated dose is to be given after the dose get over or not. A transcription. This consists of a direction to the patient regarding to the method of the administration. The dose, if given orally, route, frequency of administration, preferably with the time of the administration, duration, any other specific instruction, signature of the physician and the registration number. Label. In case of compound prescription, the pharmacist should be prepare a label to be attached to the container of the prescription. The label should be included information about the type of prescription, example mixture, lotion, ointment, etc. The special direction, example shake well before use or for external use only. The name, age, sex, and address of the patient, direction to be the patient, signature of the pharmacist, date and address of the dispensing pharmacy. General instruction about the prescription. Prescription should be clear, concise, complete, accurate, and legible. Illegibility may be avoided using the electronic entry devices and pre-printer prescription. It should be the included complete information of prescription, patient and medication. It should be written in a indelible ink pen. The age of the individual should be in a year, except in case of the children under the 5 years, where the age should be in a year or and a month. The provided indication for all prescription diagnosis, even when the obvious through the prescription, so that the pharmacist does not make any error in the dispensing, even if the prescription is not clearly legible. The number should be written in a numerical as well as in a word. They never pre-sign in a blank prescription. Do not make any changes or cross out avoid a overwriting. It should be advisable that doctors should be prescribed medicine on their own letterhead. The blank prescription sheet should not have name of the pharmacy or pharmaceutical company imprinted. Doctors should not loan their prescription pad to anyone and should keep them in secure centralized location. Any non-pharmacological instruction like the dietary advice, education on lifestyle changes should also be included in the prescription writing. Further, make that the patient has understood the instruction to improve the compliance and the treatment outcome. Revise the prescription to make it sure it correct. Given is a format of a prescription. Thank you, friends.